Hey, hello, this is Mike Flynn, Certified Athletic Trainer with O'Neil Orthopedics and Sports Medicine. We're going to talk a little bit about ankle injuries today. Winter sports, football or basketball, wrestling, their ankle injuries are pretty common in most of these winter sports. The classic ankle injury is going to be a lateral sprain. You step on somebody's foot and your foot rolls to the outside and you sprain the ligaments on the outside of your ankle. I'm gonna assess that injury. I'm gonna get my hands on you and evaluate the status of the lateral ligaments. I do a series of tests, where I put stress on those ligaments, and gives me a pretty good idea of the extent of the injury. If everything stops hard, that's good, and if it doesn't stop hard, that's not good. But that's a pretty good way to evaluate them. Initial treatment, pretty classically, is rest, ice, elevation, compression. The pretty common stuff. I'm going to set you up on some crutches if we need some crutches. But the crutches are just to help you get off the crutches. So that needs to go pretty fast, hopefully. Of course, if we suspect a fracture, we'll shoot you up to see one of the docs and make sure that there's nothing crazy going on. Rehabbing those things, I like to do a lot of closed chain activities. That's foot on the ground stuff. I'm going to do balance work. I'm going to do toe raises. I may use some tools like a BAPS board, or a board that creates kind of an unstable surface that we can train on, or maybe a BOSU ball. That may be another tool that I may utilize in the rehab. I'm going to get you back and moving as quick as I can. I'm probably going to put you in an ankle brace or use some tape to help support that ankle as you transition back to full bore. So hope these tips work for you. See ya.